Okay, we're going to be going over chapter 39, which has to deal with confusion and dementia. So, as we age, we can have changes in our brain and nervous system. That is natural. But there are certain diseases that affect the brain, and the changes in the brain can affect the cognitive function of the brain. Cognitive means relates to the knowledge or to our knowledge. So cognitive function involves your memory, your thinking ability, your reasoning ability, your ability to understand, your judgment, and as well as your behavior. So confusion has a lot of causes. Um, Diseases and infections can cause change. It can cause us to become confused. Hearing and vision loss can askew our ability to interpret things. So therefore, confusion can occur. Hearing and I'm sorry, medication side effects. Medications can cause confusion, brain injury, of course, and with aging, there is a reduced blood supply to the brain because our arteries and our veins less elasticity, and they can get smaller, and so because of different things, and therefore the blood supply to the brain can be reduced. So what happens when a person gets confused is will be able to observe personality and mental changes from that confusion, and their memory and their ability to make good judgments is lost. And the person may not know people, they may not know time, and they may not know place. Now, in most confusion, or a person who has difficulty with or who has dementia, the first thing that goes is time. They lose track of time. They don't know what day it is. They don't know what time of day it is, that type of thing. Usually the first thing to go is time. Then it can gradually move up to place. And then there's often our situations, they can lose track of those or have um, sequentially problems. There's all kinds of things that can take place with this. The last thing they usually lose is their name, their self. That's their, you go by your name. That's who you are. Now, there's other facets of you by all means, but you don't usually forget your name. So that's one of the last things to go. Should you have a person has severe dementia or Alzheimer's, and Alzheimer's is a form of dementia. So some people will gradually lose the ability to perform their daily activities, and behavior changes are often common. And angry, they can be restless, they can be depressed, they can be irritable, they can be cheerful, they can be cooperative and pleasant. The spectrum of mood changes that have or go through range the whole entire spectrum from being, exceedingly happy to exceedingly rage, anger. So let's see here. Um, in delirium is an acute confusion. I think I've explained delirium before, but delirium always has a cause. It occurs suddenly, it's usually temporary, and causes can include infection, illness, injury, medications, and surgery. And treatment is always aimed at the cause, because if you can get rid of the cause of the delirium, most of the time it clears up, and they'll go back to whatever their baseline was. So confusion caused by physical changes, though, can't be cured. And so we do measures that basically try to help improve function as much as possible. And there's also in your book something called pseudodementia. And pseudodementia means a false dementia. And basically, the person has signs and symptoms of dementia, but actually, there's no changes in the brain. And they can tell that via a CT scan or an MRI. And it can occur with like delirium, or even depression can cause this pseudodementia. And but you would not be able to tell that. The doctor would have to be able to diagnose that. but you could certainly report your observations. So getting back to delirium, um, when you are, um, you should refer to box 39.2 on page 612 in your book, that goes over caring for persons with confusion, such as you want to maintain their day-night cycle as much as possible. You know, you need to explain what and why, and sometimes it takes several times to explain this to someone, because remember, they can't always process, and if they have dementia, their processing can be even more, um, what's my word I want to use? In trouble. It's not, that's not the word I want, but it is skewed. And so with them unable to process, especially as quick as you can ask a question, you have, sometimes you're going to have to repeat it, but always be explaining what you're doing, even if you have to do it step by step. Um, you want to make sure you state your name, show your name tag, you know, face the person, speak clearly, because a lot of times with the dementias or even in delirium, they their behaviors are going to go to the opposite, like they, and they could be cooperative, and you know they think you're their friend and you're the best thing in the world. When that behavior kicks in, you know they're experiencing paranoia. You're trying to kill them, you're coming to attack them. They think all kinds of things. So that's why it's so important that you go over the box, because in some form in this box there's a test question. Okay, so you want to make sure that you give clear, simple directions. Don't give long lists. You know, you want to say something as simple as stand up, sit down. You know, you ask them something, you keep it very, very simple and very short, direct. You don't want to try to, do you want to do this, this, and this? They can't comprehend that many choices anyway, and it just makes things worse. So you always have to keep it simple. Okay. Um, Also use your environment. Their environment, you want to use what they've got available in their rooms. And I probably am ahead of myself, but I wanted to go over that box because you want to use environmental cues like calendars. That's why they have a big activity board at Red Banks, so that they can go and they can see what the activities are. Now, of course, that's all in writing, but they can have activities are done up in pictures. So whatever the person uses, and that's why they keep pictures of their family nearby, so that they can, that's a reminder of who they are, who they are connected with. Okay. So and don't get upset with them. You really have to use a lot of patience, because I mean they can say some really mean things, you guys. I mean, they can be quite derogatory. They can be calling you names that are really not very nice. You have to kind of maintain this calm demeanor, because the more excited you get, the more escalating their behavior will become. And then again, like I said, break your task down into small, simple steps. Don't try to, taking a bath involves a lot of steps. Wash your face is one piece of that big take your bath. So sometimes you have to just do that, or hold your rag, put your rag up to your face, rub on it. I mean, it depends on the severity of the dementia and their cooperation of what you can do to get them to cooperate in order for them, again, to be optimal functioning to their best of their ability. And then you have to be consistent with them. So make sure you read over 39.2 on page 612 in your book. So let's move on to dementia, because I kind of got ahead of myself. But dementia is basically the loss of cognitive function that interferes with the person's routine or their social activities or even their occupational activities. So, and dementia is not a normal part of aging. You might have a grandmother who's right on dot. I mean, she is with it, and she might have some forgetfulness. You might have a few forgetfulness, but does that mean you have dementia? No. But when you start losing function that interferes with your ADLs and these other things, then you certainly should be checked out to make sure that you don't have dementia. So some early signs, early warning signs include recent memory loss that affects a job skill or problems with common tasks, um, problems with language, getting really simple words, getting lost in familiar places. Now, everybody can get lost in an unfamiliar place. And, what do you do when you get lost in an unfamiliar place? You start asking questions, you're looking for your environmental cues, whatever the case may be. But you really don't get lost in your familiar places. Okay? They can misplace things and put things in odd places. Maybe they put their keys in the refrigerator, just things like that. And personality changes. And some families are very astute about catching these. And then sometimes, and more often, it's the dementias are gradual. They're not always sudden and not like the deliriums that just like, whoa, what happened to you today? You can't, to mom today, she can't find this. She put this somewhere. She's not acting right. That's different. When the dementia is gradual, sometimes families, and it's an adjustment for a family too, so they can be kind of, yeah, mom's always been that way, but she's done that in the past, no big deal. It can be, they may not see as many changes as the staff does. So they can definitely have some personality changes. Their judgment will become poor or decreased, and sometimes they just lose interest in life. Well, loss of interest in life can also indicate depression, so it definitely always has to be checked out. Um, And really, dementia is a group of symptoms that occur with certain diseases or conditions. It's so it can cover a lot of things. That's why Alzheimer falls in dementia. It's a type and it's a group of symptoms that is particular for this type of dementia. Um, and most older people really don't have dementia. They really don't. But now, if you work in a nursing home, you'll feel like they all do, but that's not really true. Um, and I think we can move on to the next thing. Now, there are some, like I said, if they're experiencing dementia, um, or especially if it's sudden onset, then we are going to be looking for causes. And treatable causes of dementia include drugs and alcohol. What kind of, and it can be, and when I say drugs, it doesn't have to be illicit drugs. We're talking about prescribed drugs. Sorry. Delirium and depression, tumors, heart, lung, blood vessel problems, head injuries, infections, vision, and hearing problems. Sorry. I'll try to not be coughing too much, but if I do, just hang in there and keep listening. Now, permanent dementias result from changes in the brain, and they don't have a cure. And Alzheimer's disease is the most common type of permanent dementia. Sorry about that. Just keep listening because I'm afraid this cold, the more I talk, the more I'm going to cough. So just keep hanging in there with me, okay, you guys? So we talked about a little bit. Okay. Pseudodementia again means false dementia, and I've kind of already gone over it, so you can kind of just read this slide. Um, and depression is the most common mental health problem in older persons. So depression, aging, and some drug side effects have similar signs and symptoms. So anytime you see a change in the behaviors or their personality, that should be reported, and then the nurse needs to come and assess it and notify the appropriate medical persons. So maybe they have mild cognitive impairment, and they can have some ongoing memory problems, language problems, or other type of mental function problems. It not have they don't have loss. Try this again. They do not have other losses like confusion or attention problems or difficulty with language. Um, so it comes and goes, or you might see a loss in one area, but it's not all the time, and it doesn't interfere. And the most important thing here is it doesn't interfere with their daily life. They may develop Alzheimer's disease though from this. Okay, hang on. The main thing to remember is that with dementias, eventually their ADLs are going to be affected, and then that's where we step in. Uh, let's see. And mental functions would include attention, judgment, reading, and writing abilities. The person may be aware of it. Most of the time they are, and sometimes they try to hide it too because they're embarrassed. So they don't want to look like they're stupid. So in Alzheimer's disease, it's a brain disease, and basically here nerve cells that control intellectual and social function are damaged and they die. Now, do they truly know the cause of Alzheimer's? They do not. They do not know. Now, they've come a long way in research in trying to understand Alzheimer's, um, and so your book as well as anything you see on a test, if you were to get that type of question, is they do not know what causes Alzheimer's, because some people uh, may have a genetic component that would attribute to the development of Alzheimer's, but siblings may have the same genetics or similar genetics and don't get Alzheimer's. So they truly don't know what's causing it, but they have learned a lot about it since they've been working with this for quite a few years. So the person has problems with work and everyday functions. They can have problems with their family and their social relationships, and there is a steady decline in memory and mental function. The disease is gradual in onset, and it usually occurs after the age of 60. Again, the cause is unknown. And the classic sign for Alzheimer is a gradual loss of short-term memory. Now, they can tell you what happened to them years ago, excuse me, but they can't tell you what they had for breakfast, or they can't tell you what they did 5 minutes ago. I mean, that's how it affects their short-term memory. Eventually, as the disease progresses, then they move back in time. So their short-term memory, like is today, of July the 5th, but later on, maybe they only remember July the 5th, 1952. You know, so their age will be different, and they'll tell you that they're maybe 40 years old when they're 65 or 70. So the disease always progresses backwards, and as they progress backwards, they lose function. So like that loss of time, loss of place, and eventually, I've only seen one Alzheimer's patient lose identity, which is their name. They could not recognize their name. So there are stages of Alzheimer's, and it's often described in terms of three stages: mild, moderate, and severe. And the Alzheimer's Association describes 7 stages. First, there's no impairment, and then there's very mild cognitive decline. then mild cognitive decline, then moderate cognitive decline, then severe